Hi, my name is Emily Siener, and I decided to do my project on the importance of oncology nursing in Kenya. So, for a quick overview on my topic, the absence of oncology programs in Africa is a serious problem, but countries such as Kenya are using state of the art technologies to develop new ways to combat this problem. So, for a background on my topic, 6 out of 22 of the African countries do not have established oncology programs. However, I decided to focus my research on Kenya because of how significantly better they are doing. Kenya has programs for nurses to extend their education, such as doctoral and master degrees. They have hospitals that can train nurses, and they are working to develop public insurance programs to help patients fund their care. I wanted to focus on some very scary statistics to bring light to this problem. Africa accounts for 5.8% of global cases, but 7.3% of mortality. This is obviously much higher than America and Europe. It is projected that in 2030, the population of Africa will be about 1.56 billion, with 1.27 million cancer cases and a death rate of 0.97 million. Cancer is now the third leading cause of deaths in Africa. I also wanted to address that Kenya has 22 oncologists for 46 million people. The graph on the bottom of my poster shows the mortality rates in Kenya. I decided to focus my research on the Moi Teaching and Referring Hospital because they have used public funding to further their cancer programs and help their patients. In April of 2001, as part of the Millennium Development Goals, African heads of state agreed to allocate 15% of national funds to combat cancer. Unfortunately, Kenya just gets 6% of the national fund. However, hospitals such as the Moi Teaching and Referring Hospital have used these funds and brought a lot of change to this serious problem. So the Moi Teaching Hospital developed a lot of programs to help healthcare providers treat and diagnose services. They also trained all of their members to work well together with a multidisciplinary team. They also encouraged their staffers to take part in exchanges to North America to learn from experts. In the graphs in the middle of my poster, it shows both how the staff members have increased and how the patient visits have increased as these programs were developed. In addition, rural outreach hospitals have been built as a part of these funds, and they train nurses to perform specific surgeries, monitor patients before and after surgery, support their patients during radiotherapy, and administer chemotherapy drugs, which is very important to saving lives. So I wanted to highlight the importance of this issue. Nurses obviously play a very important role in caring for patients, and they often bridge the gap between patient and professional. They're the first point of contact with patients, and they lead the fight against cancer. They design programs in Africa's political, economic, and social environment, which is very important. However, a lot of times nurses will leave Africa to migrate and find better jobs with better working conditions, which becomes a serious problem because nurses are leading the fight in saving lives. So, in conclusion, the importance of a strong oncology program is extremely important in Africa and plays a tremendous and critical role in saving lives. They're at the front line of the epidemic. We need to continue to train these nurses in Kenya and provide funding for them. Oncologists and advising is very limited in Kenya, and the importance of nurses is extremely critical in this process. Thank you. If you have any questions, please feel free to ask me them now. Thank you.